Hi, this is Dr. Mapakshi. Today I'd like to talk about elevated blood pressure and hypertension and what are the implications and how you can naturally lower your blood pressure without having to, add more medications. So hypertension, as we all know, is one of the chronic diseases that can cause kidney disease, heart disease, strokes, dementia. And it is very important to monitor your blood pressure regularly. As you all know, it can be completely asymptomatic, so the key is to check your blood pressure at regular intervals to see if there is any elevation. A normal blood pressure is anything under 120/80. It's definitely called hypertension if your blood pressure is more than 140/90. When your blood pressure is between 120/80 to 140/90, we used to call it pre-hypertension in the past, and we recommended just monitoring with the lifestyle changes. But now there is enough data to suggest that any blood pressure above 120/80 can cause end organ damage, and it is really important to actively bring it down. So today, in addition to medications, I'd like to go over some lifestyle changes that you can do every day to improve your blood pressure numbers. So hypertension is very prevalent, is seen anywhere between 30 to 35% of adults between the ages of 30 to 80. The reason we are concerned about hypertension is over the past 3 decades, due to lifestyle changes, the incidence of hypertension has increased and almost doubled. And it causes both macrovascular and microvascular changes, which leads to multiple diseases. For example, some of the macrovascular impacts of high blood pressure include heart disease like myocardial infarction, strokes, peripheral arterial disease, and some of the microvascular complications of hypertension include kidney disease, retinopathy, multi-infarct dementia, LVH, which is left ventricular hypertrophy leading to diastolic heart failure, to list a few. So it is very important to focus on blood pressure control, and right now the controls are not great just with medications alone. So there are certain lifestyle changes you can incorporate to improve your blood pressure numbers. Even a 5 to 10 millimeter decrease in your blood pressure with lifestyle changes can significantly decrease the need for pharmaceutical interventions. There are 4 things I'm going to focus on today to discuss about natural ways of bringing down the blood pressure. The first and foremost, as always, is going to be diet. There has been a lot of studies. You all have heard about the DASH study, which are dietary approaches to stop hypertension study, which focused more on fruits and adding high potassium foods, decreasing sodium, and how it has a significant impact in lowering blood pressure naturally. So why is it important to add these to your diets? If you can understand that, I think the compliance, once I tell the patients why it's important, they're able to focus on it better. So nitric oxide is produced in your blood vessel, and it causes natural vasodilatation, which brings down your blood pressure. So nitric oxide is in dark green leafy vegetables, beets. They immediately cause an increased production of nitric oxide in your diet. So after you eat a salad, there are test strips available which can test your nitric oxide level. So you don't have to do this, but I'm just explaining it so that it makes sense. When you eat a salad and do the nitric oxide strip test, it is going to be positive. There is a significant improvement or production of nitric oxide immediately after you eat a salad. Some of the foods that can increase nitric oxide naturally in your blood vessels, and that is going to lower your blood pressure numbers. So you want to add at least, I would say, anywhere between 4 to 6 cups of greens per day. So you want to do 2 cups in the morning, 2 cups in the afternoon, 2 cups at dinner, so that you get enough nitric oxide. So that's one way of doing it. The second thing is magnesium. So oral magnesium supplements have also shown that is supposed to cause smooth muscle dilatation in the blood vessels, which can also help lower your blood pressure. So magnesium oxide, sulfate, glycinate, those are some of the salts that are available as supplements. Magnesium glycinate has a high bioavailability, so I would recommend that. Typically about 500 milligrams per day should be adequate. Some of the natural ways to get magnesium are pumpkin seeds and almonds. So soak some almonds, take out the skin, have about 5 to 6 almonds a day. That's a good source of magnesium. Pumpkin seeds have a lot of magnesium. There are a lot of foods, again, greens have a lot of magnesium. So that's why we want to focus on diet, because it gives you so many things naturally instead of taking several different supplements. So that's the second thing you can do. Absorption of magnesium is great through the skin. There are not adequate studies with like Epsom salt or magnesium sprays, but that is also another great way to get enough magnesium, because the absorption of magnesium through the gut can sometimes be tricky. In some patients, it can be associated with diarrhea. And so taking it, there is great absorption through the skin. So Epsom salts and magnesium sprays are also other alternatives for people who can tolerate oral magnesium. The third thing that I want you to focus on is exercise. Exercise definitely has a significant role in lowering your blood pressure. It causes release of endorphins, which again cause vasodilatation, helps with blood pressure lowering. And so at least 150 minutes of exercise per week. And again, you can split that into strength training for 2 days, 2 days of aerobic activity like walking, biking, swimming, running, whatever you want to do. But make sure that 2 out of those 5 days you work out or strength training. And then the other natural way of lowering your blood pressure is diaphragmatic breathing. So vagal stimulation. So we have 2 nervous systems, right? The parasympathetic nervous system, which is the rest and digest, and the sympathetic nervous system, which is the fight, or flight response. So parasympathetic nervous system causes vasodilatation, so your blood vessels are relaxed and your blood pressures are lower. Sympathetic nervous system, which again is stimulated when you're under a lot of stress, actually causes vasoconstriction, which leads to elevated blood pressure. So by increasing your vagal tone, vagus is one of the 10th cranial nerve, and it is the main nerve in the parasympathetic nervous system. So vagal stimulation is associated with heart rate variability. A very high heart rate variability is one of the signs of having good vagal tone. So there are studies that show that when your heart rate variability is low, you're at a higher risk for hypertension for sure. So when you stimulate your vagal nerve, it helps with your blood pressure. That's the bottom line. So how do you do that? The easiest way to do that is with breathing. So you want controlled, slow breathing and diaphragmatic breathing, or abdominal breathing we call it. So 10 minutes in the morning, 10 minutes and in the evening of slow diaphragmatic breathing is going to help improve your vagal tone, and that is going to significantly help your blood pressures to come down naturally. So how do you do that? When you take a deep breath, you want to push your diaphragm down, so you push your abdominal muscles out. The same thing, that when you exhale, you pull your abdominal muscles in, that pushes the diaphragm up, and you breathe out. So when you do that slow, controlled abdominal breathing, 10 minutes in the morning, 10 minutes in the evening, it's going to be very helpful. Next thing is low sodium intake. So low sodium intake, anyone with blood pressures more than 120/80 need to watch their sodium intake. Sodium is sodium chloride, sodium bicarb, anything that says sodium is salt. So you want to limit your salt intake to less than 2,000 milligrams per day. Even less than 1,500 milligrams per day would be a better option. So anything, eating out, canned foods, pickled foods, all of that need to be eliminated. There are salt substitutes available, which is a combination of sodium chloride and potassium chloride. So people with kidney disease need to pay extra attention, because when you take in too much potassium chloride, it can affect your serum potassium levels, and so that needs to be monitored. But with people who don't have kidney disease, people without kidney disease can definitely use the salt substitutes. And again, when you meet with your physician, go over your electrolyte pattern to make sure that it's safe for you to do that. So these are some of the things you can do to naturally lower your blood pressure. I hope this helps. Take care.